Hashim Ahmed. I'm the former General Manager of Sudan Railways, so I'm interested in Sudan and what Hania is doing now in Sudan. I think she had done a good job, and I was sad to hear that she hadn't been exempted from certain things, the energy, the electricity, and even the taxes. I hope they will not ask her to pay something for the building itself or so. I mean, what if she's not a strong lady? She wasn't a strong lady, she couldn't have survived under those conditions. My question, have you got any trial also with the assistance of the gentleman on the board for support from the United Nations, financial support? I know this gives me a sort of insight to what we in the diaspora could do from what you presented as far as education, training, etc. And then the private sector. So you have both the private sector, and the diaspora as help. So could the United Nations, or did you ask for any help from the United Nations to support you in these difficult conditions? Thank you.
Okay.
Perhaps Peter, you can.
Unfortunately, it's catch-22 because we are not government, of course, and we are not private. We are private but non-profit. Whatever, as you see, we had to subsidize until we got to Brookhaven, and now they want, I mean, they come and they say, yes, you're doing a great job, but they say all the international institutions, they only support or give equipment or whatever to governments, and you're not government. So, I don't know. That's what, if something new happened.
You have anything to add, or? Okay. Okay.
I will come to you. Let me take from any other at the back. Yes.
If you can introduce yourself, and then I'll come back to you.
Hello, thank you very much for this nice evening and very educating. My name is Erid Osman, and I'm a postgraduate from the University of Nottingham, did Environmental Management MSc. My question is for Mr. Abdallah. You did speak about diaspora and you want them to engage in the SDG projects in Sudan. Could you just elaborate more on someone like me, how could I get engaged, and if you have any website or any recommendation for me? Thank you very much.
I mean, as I said, I'm here to listen more than anything else. I have no specific solutions. I mean, each one's talent is needed. By the way, you spoke about livable wage. In UNICEF in Sudan, we pay a livable wage. So I can tell you what actually is online. You can see. We encourage talent to come back because there's a lot of brain drain. But again, talking about the environment, what we haven't spoken about actually is what's happening to the environment in Sudan. Sudan's agriculture actually is mostly rain-fed, despite the Niles, right? Rain has been diminishing in Sudan. There's deforestation happening in Sudan. Actually, the green belt of Sudan actually is moving downwards. Sudan is actually doubling in population in the next 30 years or less. So imagine all the challenges I mentioned, and this is happening as we speak. And actually, a number of things are happening in the economy and the sort of the bread basket. It's really a challenge. It's those energies and talents could be brought back to Sudan. So I mean, I would say just engage with the community here. And one final point I wanted to haven't discussed earlier. The government of Sudan, for instance, thanks to our push, also committed to reaching. There's a global level of general education of 20% that the Global Partnership for Education actually requires to receive funding from. So the government has committed recently to actually reach that in the next 2 years. So that's another positive thing that's happening.
Okay, thank you.
I will give the question here.
Okay, thank you very much indeed. My name is Najib. As Abdullah had described me, I am a boy of UNICEF. I spent all my life in UNICEF, and I'm still working for UNICEF, even though retired. I have a private company, but I'm not a businessman. As a friend of mine described me as a businessman under training. So I didn't think about any business opportunity until I listened to the very interesting discussion. I had so many issues, but I just would like to take one or two quickly. My company works in healthcare. We work with a partnership with a British company called the International Hospitals Group. It is probably the largest private company internationally. And we're working with the Ahfad University to build a teaching hospital. It's a very interesting project where I could see private and public sector coming together. The Ahfad University, irrespective of the incident that's happening now, it's not a private university, it's an Ahliya university owned by the community. And we're building a teaching hospital. A teaching hospital, basically, it is two hospitals in one. A public hospital for training the students, and a private wing that generates money to sustain the hospital. Because the Ahfad University has never been known as a private entity that makes money. We're all very poor. So it's an excellent opportunity. We had the company who did the feasibility study 4 years ago. We met Dr. Hania, we visited the hospital with the British team. We were very, very impressed. Because of the structure of the hospital, 2/3 of it is public, we're able to attract funding from funding institutions like the African Development Bank, the Arab Development Bank, and so on. And they were all very enthusiastic about the project, but they're asking, where is the local investors? If you're telling us this is good, sustainable. So we had a good round of fundraising locally, and we're very pleased that I think it's the good reputation of the Ahfad University. In one round, we got 50% of the funding for private fundraising. And the next phase, we were thinking of the diaspora. And I didn't know really who to talk to. So I think it's a very good opportunity. All of us, I think, we could see how to organize this.
Doctors and lawyers.
Yes. And then in your presentation, you mentioned something very interesting about agriculture in Sudan and the River Nile and so on. We had a partnership with ARID, with open theme about desert agriculture, which is extremely profitable and can make good contribution to public and communities and so on. I don't want to continue, but thank you very much. It was very interesting.
Thank you very much. Do you have any question on Arabic from the Facebook? Can you see Salman? In English?
There is one in English. First of all, a lot of people were congratulating Dr. Hania on her work and what she's contributed to the Sudanese people. And they wanted to know if there was going to be branches opening up in the rural areas, or just the one in the capital city.
Okay. If any one of you want to make any final comments, because we need to close the session.
As you can see, really, if you want to make a center of excellence, and in Sudan, I mean, we have only one machine, and it's really very difficult to have another one. It did cost a lot, millions to do the building, and so I did my bit, and I'm quite ready. And the feasible thing is, we have, like in Soba Hospital, it's a university hospital, got a lot of very good doctors, and we have a mammography machine. We are very happy to train them, and we established in Khartoum before the peripheral. You can't have only one with all this number of population. So what we really need is tertiary, which is central. You have at least 3, Khartoum, Bahari and Omdurman, 3 centers like mine, but it's difficult for private. You see, you need money and you need experience. But this solution is you do it in the big university or government hospitals, and it is doable. We have it's just a machine and ultrasound there already there, and we have excellent doctors which we can train. In the periphery and rural, you start with the primary care, and you, as we said, with nurses and all the people in the primary care, they teach them how to self-examine themselves, then you refer them. And that will be more ideal to secondary, where they sift or filter the normal ones, they send them back, and the one who are positive or suspicious, you send them to the center or tertiary, and they have proper treatment.
Thank you. If you give them just, yes, you can have your final round of closing. Yes.
I hesitated to add something to your question, sir, because in the first instance I thought that it's very specific. I didn't know the legal background of the health care center. But then I realized on second thought that actually this is the kind of partnership we are envisaging in terms of our report. The answer received by you, it's not to the government, is probably related to those rules and regulations I mentioned about, and that rules and regulations should be made more flexible. And there is a very specific recommendation that I alluded to. It is solution meeting, solution multi-stakeholders meetings. So you might, I would suggest it, and I work myself in my own country with the UN family. I would suggest that this is exactly the kind of multi-stakeholder meetings. You come and say, we need the second machine to something that is very useful to the population of these countries, to the women. So let's find together the solution. And we'll have representative for the entire United Nations family, and we have the representative of the government, which could not deny that there is a need of such a machine, and then you'll have the private sector, and maybe together we'll find the solution to this kind of problem. So I think on second thought that it is precisely the spirit, and I'm glad that somehow you illustrated, and I could illustrate more what do we mean by in terms of our report, and making more flexible and creating a multi-stakeholders environment at the country level.
Thank you very much. Yes.
Just a final thought. There's another company that also works with us, a partner, that talks about corporate sustainability and social impact. And I think businesses should actually, beyond corporate social responsibility, the Hagar company in Sudan, social impact. I think it's a kind of positive impact that you make. So I think this is what should be the discussion. I mean, and I like the way they phrase it, social impact. Thanks.
Muna, your final word, yeah.
And so from me, I suppose I would say that for successful, sustainable enterprise, you have to grow your idea with other people from other sectors. So even if it's about desert agriculture, have teachers and doctors and ordinary people go around that idea and grow it so that it has more impact than just growing something in the desert. It grows something in the community. And thank you, that's a really good example.
Thank you very much. I want you to carry on your big applause to all these people. They have done remarkable. Thank you very much, all of you. I know it takes you quite a lot of commitment from my sister. She's traveling tomorrow from Guinea, from Sudan. Thank you very much for all of you. And as you can see, the time is very short. And also, there's many people in this building. We need to thank them first. We appreciate everything you have done. Thank you very much. And also, there's going to be lots of people going to close this building. I would like to finally thank UNICEF again. Thank you very much, Kendi, for your work. She has been in Sudan, so we promised to bring her Sudanese food at some time. Thank you very much. I would like to give you the final word, Anna, for just thank you very much for your inviting us, because this is his house. Thank you very much.
So it's your final word.
Final word. Well, I think just a huge thank you from me. Thank you so much to all our speakers for sharing all your experiences and knowledge. It's been an absolutely fascinating evening. And I very much hope that we get the opportunity to continue the discussion. So thank you very much. And I wish everyone a really good evening. Thank you.